Hello, this is Mr. Neil Writer, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope, which is due to be launched early autumn 2022. And if you're an ear care practitioner who is interested in purchasing the WAXscope and learning more, please do feel free to email info@clearwax.co.uk and we can add you on to our mailing list. So this is of a patient who attended with really narrow ear canals and quite bendy ear canals at that. And the ears are fully occluding with wax. You can see this wax has been there for a while. It's oxidized. It's almost black in colour. So we know the wax has been there for a while. It's matured, and just like an apple or an avocado, as you cut into it, the oxidization process commences and it discolours it and turns into a black colour. So the right ear, there's some huge plugs of wax here. And we just cleared the right ear. We're just having a good view of the eardrum now, so just dilating the ear canal. So here we're using our smaller speculum, the 3.5mm speculum, which is perfect for this type of ear, just a narrow, bendy ear canal. So you've got a great view of the eardrum. We can see the capillaries on the handle of malleus. Now, the left ear, this is the second ear. This is actually the more occluding of the two. So once more, we're just dilating the ear canal, and I'm just adjusting the focus. So these are the kind of procedures that I would previously have struggled when I was using head loops many years ago. Obviously, since then, ClearWax have also developed the wireless endoscope, which is suitable for all types of ears, whether it's narrow, bendy. But one of the things that we have realised with the endoscope is that it's not suitable for everyone. Some people just find it difficult to hold the endoscope whilst also performing the procedure simultaneously. So with an endoscope, it does require a high level of bilateral integration and coordination between your left and right hand. Whereas the WAXscope, although the view, it doesn't provide us a wider field of view as an endoscope does, but it's similar to an ENT microscope. So you could call this actually a 2D ENT microscope. And we've got a speculum attachment, and it's different sizes. So here, as I said, we've got the 3.5mm, and there's also a 4.25, a 5mm, and a 5.75, depending upon the individual ear anatomy that you're working with. And just like an ENT microscope or loops, you're needing to just make sure you get the focus. And with the app that we have, it's very easy to adjust the focus, and it's the focus that provides you with the depth perception. Now, we've cleared the main blockage. You've got some keratin, some dead skin here lining the floor of the ear canal, so I'm just using a fine end, just gently into the ear, just going to peel that away. And there is also some wax on the posterior region of the patient's eardrum. You can see that in the distance. So just going to dilate the ear, just angling upwards as well to visualize this plug. You can see we've got a great view, great magnification, great focus. Once more, I'm going to use the fine end. We're going to enter the ear. You can see how clear the instrument is in view. I'm just going to get a suction grip. I'm just going to maneuver that out of the posterior recess actually patient's got there. Just got some residual wax and keratin very lateral near the entrance. We're just going to use the fine end again just to peel that away. And already in the distance you can see the eardrum, you can see the short process of the malleus, but we are going to get the whole eardrum in focus in a moment. So a lot of the viewers and subscribers have always previously asked, what is it? How does it look inside the ear when you use a microscope? And this is a perfect illustration of how the view offered by an ENT microscope, at least with regards to viewing up to the eardrum, and also some loops that are available in the market. Although I'd say with loops you won't get the same level of magnification as an ENT microscope. So again, just dilating the ear. Again, you can see the blood vessels there on the handle of malleus. As you can hear, signaling it better. You'll see some still images of all the wax that removed. You can see it's quite a big haul there. And thank you for watching. And once again, if you are interested in purchasing the WAXscope, please feel free to email info@clearwax.co.uk. Thank you.